here in Dimapur?
As of now, we have only one positive case that is also under home isolation, but no positive cases is being admitted in the hospital at the moment.
So like, is there checking going on like in certain checkpoints or something?
No, we have withdrawn the checking in the entry points. That is from the government directive. But in hospital and then certain health unit, those who are coming with COVID-like symptoms like mild fever, cough, sore throat or something like that, we are being advised them to go for testing, but we cannot force them like before. And it is, most of them they come for self-testing only. But now in hospital, district hospital, those who are going to be admitted or to undergo some operation, they are all being tested compulsorily.
So there has been a rise in dengue right now. So like, what is the status?
See, this dengue, it usually happens in the post-monsoon season. Means when the rainy season is over and then there are small collections of water. So usually that is in the post-monsoon season, the dengue cases rise up. So one major activities what the public can do is we have to clean our houses, means inside, start from inside, then clean your compound. Means small collections of water even inside the house, like flower pots where the water collection is there, or like a refrigerator or AC where there is collections of water. Usually this dengue mosquito, they tend to lay eggs in those kind of places only. So once in a week, if we can go on changing the water, then if the eggs are there, it is being destroyed. So also outside the house, we tend to throw away small container, plastic, tire, coconut shell, like that. So when there is small collections of water in those containers, dengue mosquito usually they lay eggs in those area. So if we can keep our inside and outside the compound clean, we can be protected from dengue. So as of now, we have more than 50 positive cases in Dimapur. So one area is in Marwari Pati, Dimapur and Jumu area. So department is doing all the preventive measures like fogging and then destroy all the sources reduction, and then we have asked the administration to go for a mass social work last week. So I think with that measure, I think we can control the outbreak.
So there is speculations going on saying that the COVID workers and the COVID doctors are still not paid. So like, what is your stand on that?
That is, I cannot comment on that one because they're being appointed by the government. So I was told that departments are working on it, all the formalities. So maybe something will come up positive very soon.
Okay, so like basically they're not yet paid.
Yeah, not yet.
Okay, thank you.
We have 10 beds there and we have 3 beds this side. We actually have 4, but one is, something is wrong with it. So right now we are using 3 in this, the trauma center building. We are still keeping the 3 machines and 10 in the new building. But once, after some time, I think we were supposed to shift by 15th of October, but then we could not shift. We still have some things to do, like we want a recycling, reusing machine. So that also has to be installed, but then the technicians have not come. The technicians will come from, I think, Delhi. So until they come, we are not able to install that machine. So once that is done, then we'll have 13 or 14 when that one is repaired, fully functional beds.
So is there any upcoming project for hospital? Yeah.
Oh yes, that new building, once it's handed over to us, they are trying to hand over, I think, part of that new building by November to us. Then our capacity for patients will increase also. We are going to, they are going to give us one side of the building. So then we'll shift our patients. Right now we are keeping our patients in the Ayush hospital building, which is meant for Ayush hospital. So we'll shift the patients to the new building. Then it'll ease a lot of space constraints that we have right now. So we are waiting for them to hand over half the building to us by November. And the dialyzing center is working, it's going on. And after the launching of this chief minister's that health insurance, this thing, all the patients also, we are hoping that they will be inducted into this scheme, these dialyzing patients. Now also we are doing, actually these 3 beds we were doing under this Pradhan Mantri dialyzing program, that will be incorporated now with the 10 beds into the Chief Minister's health insurance scheme.
Nagaland Legislative Assembly amikan laga state laga September month de itu last session ekta takshe enaka homoy de itu Nagaland de district hospitals laga status opor question raise kuna thakise tade amikan laga health and family welfare pangni pombra response kurse ki itia tak tu amikan laga state Nagaland de 11 districts de itu district hospital ase aro trauma center laga opor de hutia dem tai janai dise ki sob district hospital de itia nimi de trauma center khan du nai will be out of 11 districts itia pasta district ase namely Mon, Twingsang, Kifri, Kohima aro Dimapur tade tai la respond de likhina ta kise ki Kohima naga hospital de 80% to complete huina ase itu trauma center laga aro yete Dimapur civil hospital de yete civil work to complete huse will be itia tak equipment khan aniule pagi ase onai to janina thakise enaka homoy de Nagaland News Network aji Dimapur District Hospital de agina ase aro ami khan yedi MS Krela Senior Meta lode jana Kuthagram ni jani paise ki trauma center nimide itu ami laga biche building itu thaka do itu proposed building ase kuise aro tahan tai janai dise ki itu building to khali rakhala pal itu tahan patients khan karne ekta duita room hulibi dibo gona tan ita ICU itu building de use kore ase aro taiba kuse itu equipments khan do ita tak aya nai itu nimi dehi itu khali rakhala pal do itu ICU ekta rakhina itu patients khan ge treat kore ase ona itu janai dise ami khan itu tagi hudise itu equipment to kitai bole ase itu tai janai dise ki itu tai la hati ku respond nai aro tai bi itu lapor de ikun na jani gona itu bi ami ge janai dise ami an ajikali saile do itu tanki laga cases ajikali bishi uthi ase Nagaland de especially ide Dimapur de to itu lapor de ami kan chief medical officer lo de jana kotha kurse to tai kuise ki itia tak toile de Dimapur de around 50 positive cases for dengue itu ulaina ase kuse aro kundu jaga de ulaina ase gule ide murkipati aro Tipupar de pishi ase gona itu janai dise aro taibra bi itu citizens kan ge itu precautions lo bole nolibi nijor laga surrounding area khan saf safai rakhile noli pani jama gurina thakan to itu saf safai guna thagile do itu ekta best precaution ase ona itu bi janai dise sadik Nagaland News Network for more news update. This is Kamidan reporting with my video journalist Aimbacham.